جامعة نلج، كلية العلوم، قسم الأحياء المجهرية الطبية Medical Microbiology Department، أن أرحب بحضراتكم جميعا أجمل ترحيب، كل باسمه وصفته وعنوانه. Good evening to all of you. It is my great pleasure to welcome all the participants today for the international workshop entitled Etiology, Classification, Nanotechnology Application, and Management of Cancer. My respected colleagues, on behalf of Knowledge University, I welcome all guests from different universities and institutes. Respected guests, the workshop is managed by Knowledge University College of Science, Department of Medical Microbiology. The workshop includes 4 seminars. First presentation, Prof. Dr. Imad Ibrahim Ali As-Sultan. The title, Cancer Etiology and Risk Factors. Second presentation, Assistant Prof. Dr. Muhammad Naji Oda, Classification of Cancer. Third presentation, with my respected colleagues, Assistant Prof. Dr. Lutfi Ali Mahmoud, Laser and Nanotechnology Application for Cancer Treatment. Final presentation with your colleagues, Dr. Dhari Aliawi, Management of Cancer. We hope that this international workshop will contribute to knowledge communications between researchers and expands our information regarding etiology, classification, and nanotechnology application of cancer. On behalf of Knowledge University, you are welcome again, and I wish the best for all. A special thanks to my respected speakers, Prof. Dr. Imad Ibrahim Al-Sultan, Assistant Prof. Dr. Lutfi Ali Mahmoud, Assistant Prof. Dr. Muhammad Naji Oda. Also, I am delighted to say a special thanks to my respected colleagues, Dr. Nashwan Adnan, Head of Quality Assurance, Dr. Isgar Farouk Rashid, Knowledge University, Department of Medical Laboratory Science, Assistant Lecturer Shilan Forhad, Knowledge University, Department of Medical Microbiology, for their preparation, and participation in this international workshop. Now, with the first speaker, with respected colleague, Prof. Dr. Imad Ibrahim Ali As-Sultan. He will talk about etiology and risk factors of cancer. Let me give you short biodata about Prof. Imad. BSc 1973, Baghdad University. MSc 1976, also Baghdad University. PhD 1982, University of Edinburgh, UK. Prof. Imad teaching experience more than 40 years. Supervisor of more than 40 MSc, PhD students. Published more than 150 research papers in local and international journals. Prof. Imad currently working in Lincoln University College, Faculty of Medicine, Malaysia. Please, Prof. Imad, the time for you. You can start.
Okay, thank you very much, Prof. Dari. Thank you for you and the university for inviting us for this workshop. I'm going just to show the presentation just now. Please try to let me share.
Yes, yes, you can.
I think we can share just now.
Yes, no problem. Open your PowerPoint on desktop, Prof. Imad. And then go to the pointer. First, Prof. Imad, open PowerPoint on desktop. Open, please, Prof. Imad. Yes, yes, thank you. Open your PowerPoint.
السلام عليكم.
Open your PowerPoint on desktop, Prof. Imad. تسمعني دكتور عماد? Are you hearing me? Yes, okay, Prof. Imad. First of all, sorry, no problem, Doctor, no problem. First of all, open your PowerPoint on desktop. تسمعني, Prof. Imad? The sound, I not hear you. Yes,
No.
now okay.
The sound is okay.
Okay.
I just want to share, first of all.
Yes, share, click on share. Click on share.
Here, this is the one. Share. Okay. Now is okay? I think now.
Yes. Now okay.
Now it's okay, I think.
Just on the glass to be larger. Okay, this one. Very good. Nice. Thank you so much.
Okay. Thank you very much. Well, first of all, my first degree, Prof. Dari, DVM, okay? Right. And the others is quite right. You have listed in the right way, right? Thank you very much. Assalamu alaikum and good morning, because here is in Malaysia, as Prof. Dari said, we are having the morning starting, really. Yeah. So thank you very much, Prof. Dari, for your invitation and the university, and also my colleagues. I was very happy to see a lot of my colleagues really here. I know them personally, right? And the others also, which I'm going to be very delighted to see everyone in listening to this lecture. Today, we are going to have this international workshop on etiology, classification, diagnosis, and management of cancer, right? My part will be on etiology and risk factors of cancer, right? And as you know, that Prof. Dari, I think he said that, but not to all. We were just few to listen that the cancer got the name of crop since a long time ago, right? So just remember the crop. You will remember that we are talking about the cancer. But cancer is not one disease, as everyone understands. It is really a collection of related diseases that can occur almost anywhere in the body. And its most basic cancer is a disease of the genes in the cells of our body. So the genomic factors are very important in understanding the disease. Genes control the way our cells work. That's why whenever there is an effect on the cellular cycle in the body, how they are behaving, the functions over there, then whenever there is any aberration in that cycle, there will be a cancer initiating. But changes to these genes can cause cells to malfunction, as we said, causing them to grow and divide when they should not divide in the way that the cancer wants, because they are already under control in division and differentiation. So these abnormal cells can become cancer. Let us look. If we want to understand cancers, we have to go for certain nomenclatures. That is neoplasia, cancer, tumor, and oncology. Those are all synonymous terminologies to understand what we are talking about. So I'm going just to go on. I cannot go on all this, but I have to give an idea about the definition of cancer, the nomenclature we have already said, and the molecular basis of carcinogens, where carcinogen is going to start the multi-step process in producing the cancer. And there are the agents who are going to be involved in that, what we call it, the etiological agents, or those who are promoting to cancer, what we call them risk factors. Right. Cancer is the best definition for cancer or neoplasia is the one which is brought by Wells. Wells, he said, a neoplasm is an abnormal mass of tissue, and you can see the mass of tissue that has been originated and created in the tissue in certain parts of the body, the growth of which exceeds and is uncoordinated with that of the normal tissues and persists in the same excessive manner after cessation of the stimuli which evoked the change. This is very important here, right? The mass of tissue, which is going to be considered later on as a cancer, right? Whenever you lift the stimuli or the promoters or the initiators or the agents which evoke the change, is going to be going on in growth. That's why we have to understand the a new growth, or what we call it neoplasia, on these pages. But this all has a relationship with the genetic predisposition and interactions between environmental and inherited factors. So interactions between the environmental factors and genetic factors are quite important determinant of cancer risk. Both of them are very important, the genetic and the environmental factors. they both contribute to the cancer formation, but environmental influences are the dominant risk factors for most cancers. Let us just look on these, what we call it, factors for risk in forming cancers. Sun exposure, smoking, alcohol consumption, all these are very important, right? Because excessive exposure to sun ultraviolet rays can cause skin cancer. And also smoking, cigarette smoking is the single most important environmental factors contributing to premature death in the United States. And there are certain cancers who can be initiated, like cancers in the pharynx, larynx, esophagus, pancreas, and some other organs in the body. Alcohol consumption also. Alcohol abuse really increases the risk of carcinoma of the oropharynx, larynx, and esophagus. And this can happen after development of alcoholic cirrhosis that everyone know what is the effect of the alcoholic cirrhosis that will promote for hepatoma, or nowadays they call it hepatoma. Previously they call it hepatocellular carcinoma, and the pathologists always call it hepatocellular carcinoma. So these are some of the risk factors. Let us look on some other risk factors. Diet also, they although the precise dietary factors that affect cancer risk remain a matter of debate up till now, right? Wide geographic variation in the incidence of colorectal carcinoma, prostate, and breast carcinoma has been ascribed to differences in diet. Obese people, obesity, the obesity epidemic in the US and spreading to other parts of the world, it is concerning that obesity is associated with increased cancer risk. It's another risk factor of causing the disease. The environmental carcinogens, those are very important. There is no paucity of well-characterized environmental carcinogens. The lurk in the ambient environment, in the workshop, in food, and in personal practices. Individuals may be exposed to carcinogenic factors when they go outside, like ultraviolet, as we said, drink water, which is containing arsenic, particularly in Bangladesh. This is a phenomenon which has been seen in Bangladesh. Take certain medications, example, methotrexate, and when we go to work, we have a lot of asbestosis that can promote for cancer again in the lung. Even in the at home, we might have grilled meat, high-fat diet, and alcohol that also can be, whenever it is being used in the wrong way, that can be induce cancer. Infectious agents also, biological agents can also have etiological causes for cancer. About 15% of all cancers worldwide are caused directly or indirectly by infectious agents, with the burden of cancers linked to infectious agents being roughly 3 times higher in the developing world than in the developed world. Age, definitely, you can see that age is an important influence on the risk of cancer. The rising influence of cancer with age is likely explained by the accumulation of somatic mutations that accompanies the aging of cells. This is the all can be risk factors, but there are again unacquired predisposing conditions to the cancer, like what? Like chronic inflammatory disorders, precursor lesions like hyperplasia, adaptive change in the cell, and dysplasia. Those are all promoting for cancer. And also those people who are suffering from immune deficiency states, they are prone to have predisposed to virus-induced cancers. So still all these, the acquired one, the other environmental causes, the genetic changes. Let us look here on cancer and the process that it has to be created in the body, starting from the normal cells. The normal cells is going to be exposed to all these carcinogenic agents, right? Whether they are acquired or environmental, right? Causing damage to the cell. The cell has the ability to be repaired, but if it is not repaired, there is a failure of repair to the DNA damage, mostly the DNA damage, because the genetic materials is going to be damaged, right? And forming the clone after the damage of DNA. Whenever there is no possibility of repairing this DNA damage, then there will be a mutation in the genome of the cell. Then there will be effect on the activation of growth promoting oncogenes and inactivation of tumor suppressor genes, and also there will be an effect on the normal alterations in the genes that is being regulating the apoptosis. This will go to increase the proliferation, uncontrolled proliferation of the cell. Then there will be a clonal expansion, and whenever there is a clonal expansion, it will assist that the angiogenesis process, and there will be an escape from immunity in the body, where there will be more and more mutations. Then tumor progression happens, then the malignant neoplasms is there in the body, where it has to spread everywhere by invasion and metastasis. So the most important here is that there are certain classes of genes who are going to be principal targets for cancer causing mutations, like growth promoting proto-oncogenes and growth inhibiting tumor suppressor genes, and genes that regulate programmed cell death in apoptosis, and genes that are responsible for DNA repair. Those are the one which are a very important player in the formation of cancer. So on the molecular basis of cancer, the role of genetic and epigenetic alterations are very important. So a long time ago, there was no evidence really on this, but nowadays there is an evidence for the genetic origin of cancer, which has been building for a long time, or decades really, but nowadays it's been proven. So the extent of this genetic aberration is only now nearing completion, made possible by technological advances in DNA sequencing and other methods that permit genome-wide analysis of cancer cells. These are very important to be stressed on in the understanding of cancer. There is a non-lethal genetic damage that lies at the heart of carcinogenesis. Carcinogenesis is the important process, which is a multi-step process that can be starting or initiating the, the cancer whenever there is a damage or start mutation caused by environmental exposures, as we said before. Right. The most important to understand on the level of genes that the proto-oncogenes, who are normal cellular genes whose products promote cell proliferation normally, those can be mutated or overexposed in a sort of version that we call them oncogenes. From this name comes the oncology, which is treatment and management of the cancer. So mutated or overexpressed version of proto-oncogenes that function autonomously have lost having lost dependence on normal growth promoting signals. And there are some, so many really, I would say, not some, so many functions that is going to be altered, like altering growth factors, growth factor receptors, single transduction protein, and nuclear regulatory proteins and cell cycle regulators. Those are going to be really altered whenever there will be an mutation in the proto-oncogenes, which means that there will be a damage. Then there will be oncogenic genes started to alter the function of the cell. Right. No single oncogene causes cancer. Both several oncogenes and several tumor suppressor genes must be involved in the cancer formation. These are facts which have to be put in mind. So always we blame in cancer etiologies three agents: the chemical agents, the radiation, and the infectious pathogens. The concept concerning initiation and promotion to form the cancer with all these blamed, or it is really a fact, after blaming they prove it, right? All these are going to be causing the cancer. We have to understand that there are some in this concept, there are some understanding concerning initiation results from exposure of cells to sufficient doses of carcinogenic agents. It causes permanent DNA damage, then mutation started, right, to form the cancer. Promoters, again, because the concept is initiation promotion, the promoters also can induce tumors to arise from initiated cells. So there must be an initiation, then after that, a promotion or promoter agents to work also to complete the process of tumorogenesis, then the cancer is started. Application of promoters leads to proliferation and clonal expansion of initiated or mutated cells. Both initiators and promoters are needed really for this process, but neither can cause cancer by itself. Initiators, when I talk about initiators, I talk about carcinogens really that can cause mutation. Promoters are not carcinogenic by themselves and must take effect after initiation, not before initiation. So promoters enhance the enhance the proliferation of initiated cells and can cause the cancer. Even sometimes they call promoters as a cause for hyperplasia in cells, even without the effect of carcinogens. And there are so many examples like the hormones and some other agents. Okay. Let us look on the carcinogens. Carcinogenesis is a process, what they call it, a multi-step process. It is really depends on the molecular damage. That's why they call it of a molecular basis. Before that, we need to understand that carcinogenic agents and their cellular interaction started really long time ago when they discovered that the people who are cleaning the chimneys, they have scrotal skin cancer, right? And according to that, they started to understand that the exposure to the soot, right? Whenever those workers are doing the cleaning, they've been affected with the developing of a mass that they call it later on cancer. So hundreds of chemicals have been shown to be carcinogenic after that, after this sort of events or discovery. Some of the major agents are listed here. You can see there is a direct acting carcinogens, and there is some of them are promoters or indirect acting carcinogens. But the carcinogens in the multi-step process, what we call it carcinogenesis, is started whenever there is an effect, right, on the cell. Carcinogens can be consumed by the body and can be detoxified, really, and excreted if it is not affecting the cell. But with the metabolic activation, whenever there is electrophilic intermediates, the carcinogens can be effective, change the DNA and damage the DNA. If there is a possibility for DNA repair, then the cell comes to normal. If there is not, cells are going to go to death, really, and necrosis. And this stage, all this stage coming with the carcinogenic agent effect, we call it initiation. This is in the concept of initiation promotion theory. Then after that, there will be starting the process of promotion, which is the cell proliferation that altered and also altered differentiation of the cells, which is very important in diagnosing later on the type of tumor mass. Then there will be clone formation. Clone formation is started after there will be a pre-neoplastic clone formation. Then after that, there will be proliferation and additional mutation in the cells that will lead to malignant neoplasms. This is the story of carcinogenesis, which is a multi-step process. If you look on chemical carcinogens, who are initiators really for the cancer, you have two types: direct acting carcinogens, as we said before. Those do not require metabolic conversion to become carcinogenic. They are already carcinogenic, direct, and most are weak carcinogens, but some are important because they are cancer chemotherapeutic drugs. This is the importance which comes of some of these. Example, alkylinating agents like cyclophosphamide. And there is a pro-carcinogens that would need activation. And those are requires metabolic conversion to become active carcinogens, and the carcinogenic products are called ultimate carcinogens in this status. Let us look on how the pro-carcinogens, those are agents who are stable really, but they can be detoxified easily and excretable as metabolites, okay? But whenever there is metabolic activation, there will be ultimate carcinogen is formed. Whenever there is a reactive electrophiles, then there will be DNA binding to DNA, damaging the DNA, causing a mutation, then there will be malignant transformation. That will happen really in so many, we have so many examples on chemical carcinogens like the polycyclic hydrocarbons, which are present in fossil fuels. And other example is benzopyridine or pyrene, the active components of soot, which Potts is the one who discovered the scrotal carcinoma in the workers, showed to be carcinogenic. These are just an examples for that, and there are so many other examples on dyes that can cause cancers, and also food which has been containing aflatoxins and some other chlorides and turpentine agents. The other microbial agents that can cause carcinogenesis process to be initiated, and those are really some oncogenic viruses. Oncogenic viruses may be RNA and DNA viruses that have proved to be oncogenic in animals and in man. However, only a few viruses linked with a human cancer all the time, human oncogenic virus, as well as the role of bacterium. This is bacteria, not virus, because it is with the microbial agents who can cause cancer or carcinogenesis, like the bacterium H. pylori causing gastric cancer. It is just an example of microbial carcinogenesis. A common theme in the pathogenesis of microbial carcinogenesis is that the infection triggers cell proliferation, which is initially polyclonal, but with time becomes monoclonal by acquisition of driver mutation in rapidly dividing cells. Oncogenic viruses and cancer, we have so many diseases that is being caused by Kaposi, sarcoma, herpes viruses, right? And hepatitis B and hepatitis C viruses and hepatocellular carcinoma, human T-cell leukemia, virus 1 causes T-cell leukemias, human papilloma virus, which cause cervical carcinoma, and Epstein-Barr virus, who cause B-cell lymphoproliferative disease and nasopharyngeal carcinoma. There are some other microbial agents, as we said, bacteria like H. pylori, and also some parasitic infections strongly associated with cancer like schistosoma, hematobium, and liver fluke, right? The radiation, which is the one also to be blamed as etiology for cancer, those are all can cause cancer like radiant energy, whether in the form of the UV rays or sunlight, or as ionizing electromagnetics, and particulate radiation can transform virtually all cell types in vitro and induce neoplasms. UV light, as we said before, can cause skin cancer, and ionizing radiation exposure from medical or occupational exposure, nuclear plants accident, and you know all about the nuclear bomb and the atomic bomb detonations that have produced a variety of forms of malignant neoplasms like leukemia and the blood cancer. Sources of ionizing radiation include medical imaging, and radon gas is also involved in that. Non-ionizing radiation from ultraviolet radiation induced leukemias, which typically requires 2 to 10 years to appear or develop. Some people, such as those with nevoid basal cell carcinoma syndrome or retinoblastoma, are more susceptible than average to developing cancer from radiation exposure. I think I would like to say thank you very much for listening, and I hope that people are listening to what we have said. I'm going to be present whenever there will be an questions and answers later on. Thank you very much for your listening, and thank you for the Prof. Dari and my colleagues, really. And I think I'm ending my talk. Thank you very
Thank
much.
you.
Bye. Thank you.
Thank you so much, Prof. Imad, for this amazing, really amazing presentation. Thank you so much. Thank you so much.
Thank you.
The second presenter, Assistant Prof. Dr. Muhammad Naji Oda. He will talk about classification of cancer. Dr. Muhammad Naji Oda, BSc 2005, MSc 2009 from the Mar University, PhD 2018 UPM Malaysia. Publication about 25 articles, research area food microbiology and One Health. Please, Dr. Muhammad Naji, because we need to benefit for the time, you can start. The time for you. Are you ready, Prof. Muhammad Aini? Dr. Muhammad, the time for you. Yes, thank you. Okay, Doctor. Okay, your PowerPoint.
Okay, we'll begin now.
Yes, thank you so much.
Okay. Can you see the slide?
Yes, yes, good, good. Okay, go ahead.
Assalamu alaikum. Good evening for all the people in Middle East. Good morning for all people in another times. I can say just for thank you, Prof. Dari. Thank you, Prof. Imad. This our my professors. Also, Dr. Lotfi. Today will be all. Cannot forget for Knowledge University and all the staff in this university for allowed to participation for the international conference workshop about for the etiology, classification, diagnosis, and management of the cancer. I will going about the classification of the cancer. The classification of the cancer, we have 4 sides. The first one about the classification by the site of the origin, cancer classification by tissue, cancer classification by grade, cancer classification by stage. The first one, the classification by site of the origin by the primary site of the organ concern, maybe for specific types like breast cancer, lung cancer, prostate cancer, liver cancer, renal cancer, oral cancer, brain cancer. The second one about the cancer classification by the tissue types. First one, carcinoma, sarcoma, myeloma, leukemia, lymphoma, mixed types. I will give some information about the carcinoma. The carcinoma is malignant tumor of the epithelial cells, which are found in second and the covering and lining of the organs, exactly for the internal passageways such as gastrointestinal tract. Also, we have two types of the carcinoma: adenocarcinoma, squamous cell carcinoma, carcinomas malignans of epithelium tissue. The almost for this the type of the cancer in about for epithelium tissue in skin or for any organs in the body. Almost for 80 to 90% of all cancer cases with this type carcinoma. The carcinoma usually affect organs capable secretion like including breast, lung, bladder, prostate, and colon. The second one for the classification by the tissue, the sarcoma, is common for humans and the animals. Malignant tumor of connective and supportive tissue cells, including muscles, tendons, fat cartilage, blood, lymph vessels, nerves, tissue around joint, bone. Bone cancer is one of the sarcoma termed osteosarcoma. It affected by the young most commonly. Also, Prof. Ahmad, he already shared for the sarcoma. The third one, myeloma cancer originating in the plasma cells of bone marrow. Plasma cells are white blood cells that procedure antibodies when in myeloma cells prevent the normal production of antibodies. The immune system is weakened and there is an interference with the normal production and function of red and white blood cells. He can do the myeloma with both of the blood content in the by the plasma, by the white cells, also by the red cells. The patient often have the bone pain or the fractures, anemia, and susceptibility to infection, more than one plasmacytoma, multiple myeloma. Leukemia, this is the important one because no any treatment sometime for the clinical science is this visible. We cannot show for this one when he created for any patient, but when he growing and develop for this the disease, then will be give some for the clinical science. The leukemia cancer of the blood involving bone marrow and lymph nodes. Bone marrow produces abnormal for WBC that fail to provide immunity, causing the patient to be prone to infection. RPC also affected can cause poor blood clotting and fatigue from anemia. There are two forms. In terms of disease progression, acute leukemia often shows fast-growing amateur. Some researchers he give for some the name for or this the case. He said crazy blood cells is growing without any control. We do the function without also the control. Abnormal cells, which is often associated with bad diagnostic and prognostic outcome. On the opposite, for the chronic leukemia, shows slow growing disease with a more indolent disease progression associated with mature cells. However, also indolent disease may become more aggressive over time. We can see for this the pictures about for the blood cells, the normal one, and the leukemia plots for in the reproduction or during for the develops. He can do like in the without any control and also do the function for the more the normal function. The number 5, lymphoma, cancer of the lymphatic system. develops in the glands or lymph nodes, exactly like this, the picture for in the slide. When any glands or maybe any lymph nodes in the body, for in the submandibular or maybe in for the parotid or maybe submaxillary, you can see for this the cancers will be coming or maybe can do some occurs in this lymph node. The cancer cells crowd out normal white cells. Immune system is unable to effectively guard against infection. Two types: Hodgkin's lymphoma, presence of red Stringberg cells, augmented for lymphocytes. Non-Hodgkin's for the lymphoma, also for this the second types or the second shape for this the case. Mixed types, there are two or more components of the cancer such as carcinoma, teratocarcinoma, adenosquamous carcinoma, whereas medical professionals refer to cancers based on their tissue type. The general public is more familiar with the cancer's names based in of the locality or local of the sites. The most common sites in which cancer develops includes the cancer he cannot exception any organ of the body. He can do for the occurs in skin, lung, female breast, prostate, uterus, colon, rectum. Cancer names based on their primary site are often not as those based on the tissue type. Some researchers and for the scientists, when he mentioned about for the name and for the cancers for any organs of any parts of the body, he give for the name exactly with the same name for the part or the organs. Cancer classification by grade, the first one by the tissue, the second one by classification by the grade. Because we have the grade, you can see the tissue for is normal or is abnormal. Also, when the tissue is abnormal, we have for some the grades, you cannot give for the one grades to all the abnormal, depend about the severe or for moderate or for the mild. The grade 0 is this normal tissue, no any occurs, no any for the cancer cells, you can give for the grade 0. Grade 1 will differentiated cells with slight abnormality. Sometimes this the case or for this the lethal, we cannot see any clinical signs or symptoms for the case of the patient when you have for the grade 1. Grade 2, moderately differentiated cells that have more abnormalities. Grade 3, poorly differentiated cells that are very abnormal. Grade 4, very and for undifferentiated and immature cells. The meaning for the cells you can do for the tissue of the organs in the parts or for the tissue. Cancer classification by stage. Also the stage, we have some stage depend about for the cases for the cancer. We can give for the T tumor size, according about for the size and also for the which the site which the organs will be occurs by this the cancer or this the disease. And we can give the N for the degree of regional spread or node involvement. M later we can see for the distant metastasis. T0, no evidence of tumor. T1 to T4, increasing tumor size and involvement. TIS, carcinoma, or some guys he said for the test, carcinoma in situ or abnormal cells that remain in the place where they first formed. We can also see in this the picture, we have some for like in the mentioned T have for T1A, T1B, T2, T3, T4. He can in here for the explain about for when he started the cancer, you can give him for the period or the stages from start this the cancer until he growing or until for do the course for the organs. The cancer classification by stage: N0, no nodal involvement. N1 to N4, also increasing decrease of lymph node involvement. NX node involvement cannot be assessed. M0, no evidence of distinct metastatic involvement. M1, evidence of metastatic and involvement. All this for the stages. The doctors, he can use it for the check-up or for the medical examination. He can give for the stage about for the cancers, which the stage for any patients is the develop for cancers, or maybe for the beginning for the cancers, or maybe the end of the cancers. Then he can do the mention about for these stages. We have in here for stage 0 carcinoma in situ early form, stage 1 localized, stage 2 early locally advanced, stage 3 no 2 late locally advanced, stage 4 metastasis. The stage 1, 2, and 3 cancer is present the higher for the number of the larger the tumor, and the more it has spread into nearby tissue. Stage 4, the cancer has spread to distant part of the body. Metastasis, cancer cells migration or migrant through blood vessels, the tissue. Cancer spread by moving into or invading nearby normal tissue. Cancer cells break away from where they first formed. Primary cancer move through the blood vessels or lymph nodes, traveling to other parts of the body. The commonly in this time, I think for in 1960 or 1970, the breast cancer percentage in the woman, I just saw some mention about for like in Arabic or Asia women's, how about for the stages or maybe the percentage for the, of course, the cancer. The Arabic women are often diagnosed at advanced stage of breast cancer, representing an estimated 17.7 to 19% of all new cancers in 2018. Rate of breast cancer among Asian women, incidence of breast cancer is estimated 40%, based on current incidence rate for 12.9 of women born in the United States today will develop breast cancer at some time during for their lives. I saw it for many researchers when he mentioned about for the age, he said for the cancers or maybe for the grades for the cancers is different according for the age, according for the economic is poor or middle for the income for the country. All this the factors he can affect about for the cancers, exactly the cancers with the breast cancer in the woman. We can saw in here for about the age 30, the percentage around 0.49, age 40 when he growing, or maybe when this the woman's is the grow. For the old age, you can see for the last age for around 70, the occurs by the cancer is more than for the young age. I mentioned for this slide about for the percentage, and from the prostate cancer, the first one about the 52% about for this the man. The woman also can for the breast cancer and 39 from 1989 until 2015. This one about for the colorectal cancer in both for the woman and man. The percentage is very high, 52. And for the lung cancer in man or men from 1990 to 2015, 45 percentage. And last one for the decline lung cancer in the woman from 2002, 2015, also the percentage around 19. I think I am done for my slides today for about the classification of the cancer. Thank you for listening to me.
Thank you so much, Dr. Muhammad. Thank you so much again for this nice, really, and beautiful presentation. Thank you so much.
Thank you.
Now, the third speaker, my respected colleague, Assistant Prof. Dr. Lutfi Ali Mahmoud. Dr. Lutfi Ali Mahmoud, BSc in Physics, College of Science, Baghdad University, MSc in Laser Physics, Loughborough University, and also PhD in Laser Physics, the same university, Loughborough University, UK. Teaching experience about 40 years, supervisor more than 30 MSc, PhD students. Published more than 35 research papers in local and international journals. Research interest in laser, medical physics, and photonic crystal fiber. Dr. Lutfi currently work at Knowledge University. Please, my respected colleague, Dr. Lutfi, the time for you. You can start.
Thank you very
Are
much.
you hearing me? Thank you, Dr. Lutfi.
Thank you very much. I'm going to talk about the use of laser and nanotechnology for cancer treatment. First of all, I must mention that there are over 200 types of cancer. And there are the common cancer, which include breast cancer, lung cancer, down the line to thyroid cancer. There are many methods of treating cancer. The most important of these treating methods are chemotherapy, radiation therapy, surgery, bone marrow transplant, immune therapy, hormone therapy. Now, the use of any of these treatment will depend on the kind of the cancer. Some cancer need one method and other may need a combination of more than one treatment. What the most important thing about these treatments is that they all are invasive. Invasive means they have a severe side effect. For example, standard chemotherapy destroy cancer cells and normal cells as well. That's why patients often lose their hair and suffer numerous other side effects. And according to a British study, which has indicated that chemotherapy can cause also death up to 25% of cancer patients after 1 month of treatment. Now, the holy grail would be finding a way of selectively kill cancer cells and not damaging the healthy one. A new non-invasive method of cancer treatment has been used with success. This method is based on the use of laser and nanotechnology. This combination kills cancer cell only and leaving normal cell unharmed. But before going deep inside this new method, we need to talk a few words about laser and nanotechnology. Nanotechnology is a new technology. It is the engineering and industry at nanoscale ranges. And in the stores now, we have many nanotechnology material, which we call it nano tubes and nanoparticles. And these can be manufactured from many material like carbon and gold and silver. And this picture shows some of these nanotubes and carbon nanotubes. Now, these nanotubes, they are so small, and therefore we can fit thousands of these nanoparticles inside the human cell. This is another picture for the nanocarbon tubes. And this is also another picture. So, laser is electromagnetic radiation, and laser itself is an acronym for the light amplification by stimulated emission of radiation. It is a light, but it has a special property. The most important property of the laser light, it is a monochromatic, it is directional, and it has high energy. And this light can be manufactured over a long wavelengths, starting from microwaves up to the X-ray. So laser is a device which can produce a coherent light. As I said, laser has many properties, like it is monochromatics, which means it has one wavelength or a single frequency, coherent and directional. We have many types of lasers, and the type of laser depends on the active material. There are gas laser, there is solid state laser, there are chemical laser, and there are dye laser, and all these lasers can produce different type of electromagnetic radiation in the infrared, in the visible, in the ultraviolet, or even in the X-ray region of the spectrum. Carbon nanotubes, which are synthetic cells, that they have half the width of the DNA molecules. And as I said, thousands of these nanotubes can be fitted inside a typical cell. What is interesting about these carbon nanotubes is that they absorb near infrared, which are slightly longer than the visible light. When a beam of near infrared light is shined on these carbon nanotubes, electrons within the nanotubes become excited and start releasing energy in the form of heat. In fact, when a solution of carbon nanotubes placed under near infrared beam, the solution will heat up to about 70 degrees Celsius in 2 minutes. When these nanotubes were placed inside cells and radiated by the laser beam, the cells were quickly destroyed by heat. However, cells without nanotubes show no effects. Now, to be certain that only cancer cell will be destroyed, the scientist has to find way of selectively deliver nanotubes to the cancer cell only. This can be done easily, since it is a fact that most cancer cells, and unlike the normal cells, contain many receptors for vitamin known as folate. This is the researcher decided to coat the surface of these nanotubes by folate, which will be attracted to cancer cell only. The experiment worked as predicted, and most of the coated folate nanotubes ended in the cancer cells. When laser beam is shined, most of the cancer cells died. This experiment has been done on the lab animals with induced cancer, and the animals has recovered from the cancer within 10 days without damaging the normal cells. Scientists at Rice University has repeated this experiment on mice with cancerous tumor, but instead of using carbon nanotubes, they injected tumors with gold nanoparticles and exposed the animal to near infrared laser beam for several minutes. The tumors disappear within 10 days without damaging healthy tissue. Further application of this new non-invasive method of treating cancer is that the nanotube can be injected directly to the cancer cells. For example, in the breast cancer, the particle can be injected directly to the tumor, and the breast is then exposed to the laser beam. Also, by using fiber optics technology, the nanoparticles can be delivered to any part of the body. This new technique can eliminate months of chemotherapy. This picture showed the distribution of nanotubes inside the breast cancer. Now, this picture shows cancer cell before and after near infrared light irradiation. As you can see, the cancer on the right side of the picture has disappeared completely. Thank you very much again for most of my colleagues.
A lot of thanks, Dr. Lutf, really, for this very, very nice and excellent presentation.
Thank you
Thank
very
you
much.
so much. Thank you, Dr. Lutf.
Thank you.
Now we reach the final, inshallah, speaker, Dr. Dhari Aliawi. I will talk about the management of cancer. Dhari Aliawi I start my scientific life at Mosul University, 1984. What I talk now, I so directly go to the PowerPoint because I need to benefit from the time. Sorry. Again, you are welcome. I hope all of you are good, inshallah, at this nice and inshallah not tired. Let me just some seconds to prepare my PowerPoint. Yes. It is okay.
Yes, yes, okay.
Oh, yes. Thank you
Yes,
so
it's
much.
okay.
Yes, thank you so much. As you show here, please, you are welcome again in this international workshop, Etiology, Classification, Nanotechnology Application, and Management of Cancer by Knowledge University, College of Science, Department of Medical Microbiology. My presentation about management of cancer. First of all, what's the cancer? As my respected colleagues, all of my respected colleagues talk about the meaning of cancer. That means uncontrolling growth and division of the cell. That means this division of the cell maybe go to rapid growth or slow growth. Both of them may be in some type, as Dr. Muhammad, Prof. Imad, Dr. Lutfi about this growth, this abnormal tissue growth, maybe rapid growth or slower. And this cells not in thousands, in trillions of cells accumulated, as you show here in this picture. The above part is the normal, and the lower part is the cancerous cells. As you show, there is so much increase in the number of cells. And just I need from you to pay attention about the morbidity and mortality of cancer. 5 to 10% of all cancer attributed to genetic defects, as Prof. Imad talked about this point. And look, please, to the 90% to 95% to environmental and lifestyle factors, such as smoking, diet, alcohol, and physical inactivity. Please pay attention about this. More than 90%. Cancer-related mortality, that means death, this 25 to 30 due to tobacco, 30 to 35 linked to diet, 15 to 20 due to infections, remaining other radiation, physical activity, environmental, and so on. So please, WHO reported the following data. Please, here, I need from you to pay attention. This report from WHO at 2020, 10 million deaths in this year. That means 1 in 6 deaths in this only in this year. 1/3 of death from cancer are due to tobacco use, high body mass index, alcohol consumption, low fruit and vegetable intake, and lack of physical activity. Many cancer here, this important note, can be cured if detected early and treated effectively. That means the early detection, very important in the treatment. Here, the common in this year also from the WHO, breast more than 2 million, lung also more than 2 million cases, colon and rectum about 2 millions, prostate more than 1.5 million, skin non-melanoma also more than 1 million cases, stomach about 1 million cases, and the death, the first important here, lung, colon and rectum, liver, stomach, breast, all of this, the so common causes of cancer death. Also here, please pay attention about the early children developed cancer, about 500,000, 400,000 each year. Now, I talk, please, about the cancer management. I need to give you first step in cancer management is to make perfect diagnosis. So important, clinical assessment and diagnostic investigations. The goal of cancer staging, as Dr. Muhammad talked, aid in choice of therapy, assessing prognosis, exchange of information, stop therapy in which time, determine the time for stop. And here, the basic principle of cancer treatment are same throughout the world, depend on availability of human, physical, and financial resources. And here, multidisciplinary management is this is the conclusion from so much papers, articles. Multidisciplinary management is more effective than sequential self-regulating management of patients. The overall approach to cancer management must be answered this following three questions. What is the type of cancer? What is the extent of the spread of the cancer? Is it curable or non-curable? Cancer treatment options. All of my colleagues, speakers, especially Dr. Lutfi, talk about surgery, chemotherapy, radiation, bone marrow, immune therapy, target drug therapy, cryoablation, radio frequency ablation, and clinical trials. Thousands of these trials are underway up to date. This so different type of the method of treatment. Effect of treatment, that means the relation between treatment and nutrition. This is also important point. Please, I need from you to pay attention about this effect. What are the effect of chemotherapy and hormone therapy? What are the effect of radiation therapy on nutrition? What are the effect of surgery on the patient with cancer? What are the immune therapy also? What are the effect of stem cell transplant? All of these methods affect the nutrition. Healthy cells that normally grow and divide quickly may also be killed, please, here. Because chemotherapy, hormone therapy, most of the methods kill the healthy cells. These include cells in the mouth and gastrointestinal tract. Hormone therapy add also blocks or remove hormone. It may be used to slow or stop of growth of certain cancer. Some type of hormone therapy may cause weight gain. Side effect from chemotherapy may cause problem with eating and digestion. This is the problem, please, for the patient with cancer. What we need in this point? What are the overview of nutrition in cancer care? Cancer treatment affect nutrition. This is the fact. Cancer treatment, another fact, cause malnutrition. The question here, what are the common causes of malnutrition in cancer patients? Two important points, affect anorexia, that means lack or lose of appetite. The patient lose the appetite for food. Cachexia, the second problem, cachexia, I mean weakness and wasting of the body due to severe chronic illness. Please pay attention for these two important problems with the patient affected with cancer. So, which type of food increase cancer risk? Here, the most important food increase the risk of cancer. Well done red meat. You understand? all of my respected colleagues, all of you, please, you understand there are three main types for the cooking of the meat: rare, medium, well done. The well done, that means so-so cooking. This not good. This maybe go to cancer effect. The good, it is the medium. Processed meat, especially sausage, it is also an increased risk of cancer. Fried foods, especially potato chips, other high-fat foods, all of most of food rich in fat, it is also risk foods for the cancer. Excessive amount of sugar. This is the so important, especially for sugar, please. Food preservatives prolong. This is the purpose why we added food preservative, to prolong the shelf life of food, because it is effect as antimicrobials, antioxidant, anti-enzymatic, natural substances. This one, like sugar, like finger, like spices, have been used as preservatives really very old time. And until now, there are more than 2,500 chemical substances intentionally added to food to modify flavor, color, stability, texture, and there are about 12,000 substances used in such way that may be unintentionally enter the food supply. I mean here component of food packaging material, processing aids, pesticide residue, different type of residue, antibiotic residue, antimicrobial, different type, including pesticide residue, drug residue, especially in food of animal origin. Unknown number of naturally occurring chemical contaminant also find their way into the food. The most notable for this point, please, is the mycotoxin, especially aflatoxin. People with the highest consumption, this is the conclusion of much articles, who is consumption of nitrite from animal source were more likely to develop renal cell carcinoma. Also, some studies, some articles reported nitrite can form nitrosamine, which may contribute to cancer. Also, researchers reported artificial preservative can cause serial health hazard. This all, more than 90% of the researchers reported this point about the artificial preservative cause serious health hazard, hypersensitivity, allergy, asthma, neurological damage, as well as cancer. Artificial preservative such as nitrate, benzoate, sulfite, sorbate, parabens, and so on, several other, can cause serial health hazard. Majority of preservative use today, sorry للأسف, artificial rather than natural. Several of them are toxic. This not from me. This from more than 90% of the articles. Several of this artificial is toxic, and several of others have potentially life-threatening side effect. Also, I need from you to pay attention, please, about the research proven that several natural preservatives, especially from plant, animal, microbe, mineral, contain antioxidant, antimicrobial, anti-enzymatic properties. Extract, for example, just example, extract of rosemary are promising alternative, to their artificial counterparts. That means if we need to use, we go to the natural preservative, not go to the artificial preservative. Certain contaminant in food, as I talk, mycotoxin, especially aflatoxin, this found to be carcinogenic, especially in long-term toxicological studies. This higher consumption of food rich in sugar and refined carbohydrates, please, as well as processed and overcooked meat can increase risk of cancer. This very, very important point. This most all of the papers confirm this information. In addition, higher, please, not normal dairy consumption. We need dairy consumption. Human body need dairy consumption. But when this, etc., higher dairy consumption, this linked to prostate cancer. That means when we increase the intake of the dairy consumption, this one may be go to prostate cancer. Rule of food, this for the cancer patient, sure, cancer patient need good nutrition. What is the good nutrition? As you show here, please, this more of fruits, vegetables, whole grains, dark grain, and orange vegetables. Food with that mean food with vitamin A, C, and E. Very, very important. And so little, less, very, very little amount of saturated fat, processed meat, red meat, salt, salt-cured, and smoked food. This, pay attention about this globally table. This really not from nowadays in medicine. This is from the period of Hippocrates, who is a famous Greek physician in the year 44 BSC. He said, let food be thy medicine, and let thy medicine be food. Nowadays, after 2,038,300 years, this become fact nowadays in the medicine. So in many studies, multiple vitamins, minerals, phytochemicals have been shown to have anti-cancer effect. Anti-cancer effect. What are the top of the list for prevention of cancer? For food, garlic, dark green leafy vegetables, including spinach, orange colored vegetables and the fruits, carrots, peppers, blue berries, and other fruits. There are different pictures for this part of the most important foods affect the cancer. We call it cancer fighting foods. Example, cardamom, grapes, ginger, and other type as you show in this picture. WHO also publish so much instructions, publish so much papers, so much about the way to reduce the cancer risk. The most important is smoke. Do not smoke. Make your home smoke free. Avoid too much sun, use sun protection. Reduce indoor and outdoor air pollution. The most important, physically active, healthy diet, and other important point as I talk with you to protect yourself from the disease. As Prof. Imad talk about the rule of infection, H. pylori, other disease, other cause of infection, rule of this in the cancer. Level of prevention, as you show here, primary, secondary, and so on. The most important, remove risk factor. At the starting, at the primary period, you remove. Secondary, to be prevent progression of the disease. Cancer prevention maybe lead to 3 important points. Decrease weight, physical activity, and diet as I will talk. What diet good, what is cancer effect. And you understand what are the important, what are the benefit of the physical activity, especially walking daily, at least 30 minutes to 1 hour. And the last 2 slides here, WHO and so much organizations select day for cancer to increase the awareness of cancer. And this day, February 4, February is the World Cancer Day, organized at the first World Summit Against Cancer, which is held in Paris 2000. Leaders of governments, agencies, and cancer organizations from around the world signed the Charter of Paris Against Cancer, which include 10 articles. All of these articles improving the quality of life of cancer patients. The World Cancer Day, International Day, led by the Union for International Cancer Control, and this most important objective, prevent millions of deaths each year. To prevent, to protect, to save. This is the nutrition and cancer references. If any one of my respected colleagues need it, you can go to this link. And thank you so much for your good attention. Thank you so much. Thank you again, my respected colleagues. Sorry, time okay, or I. Thank you so much. Now, if there is any comments, please. If there is any question, we are ready.
Q&A. Yeah.
راح نروح هناك
Thank
شوي.
you very much.
هلا
Sorry,
بس
Prof. Rashid. Yes, welcome.
Thank you very much. My thanks so much to all respected speakers, Professor Dr. Imad Ibrahim. My thanks to him for his important presentation. Really, so much. My thanks to Assistant Prof. Dr. Muhammad Naji for his presentation about cancer classification. My thanks to Professor Dr. Lutfi Ali Mahmoud, his presentation about nanoparticle and its relationship with cancer. My thanks to you, my friend Dr. Dari,
Thank you, Dr.
College Knowledge University, College of Science. Thanks to all of my speakers, good speakers. I am very happy. I have some small notes here. Firstly, I want to say that we must differentiate between cancer and the tumor. I think we have to speak something about this note, but we must differentiate really between cancer and the tumor. If anyone has a tumor, it is not necessarily a cancer. Many tumors begin not cancerous. That is real, that is fixed. Exactly. About
yes, thank you. Yes, sorry.
About the cause of cancer, as you have said, change to DNA, change in genes, genetic change. The name is genetic change. One important note I have here. I want 2 minutes. There are many important substances capable of damage DNA and triggering cancer.
For the tumor, it means any proliferation, any increase in the mass of the tissue, but this tumor may be benign or maybe malignant.
Yes.
Malignant, it means cancer. This is the problem with the cancer. As Prof.
I want to say we have some substance capable of damage DNA and triggering cancer. For example, excessive sun exposure, chemical carcinogens exposure, high dose of chemotherapy, hormonal drug, with relationship with hormonal drug, and immune suppressing. Immune system, very important, and relation with cancer disease. Immune suppressing drug taken by transplantation recipient. And we have biocarcinogen. Cancer and immunity, a lot of point and relationship between cancer and immunity. Immune suppressive drug make our immune system less able to detect and destroy cancer cell. Immune depressing of or fight and infection that cause cancer. Infection with HIV also weakness, يضعف, as you know, the immune system, our immune system, and increase the risk of cancer, of some type of cancer. I want to say that there are 4 stages, essential stage in cancer infection. First stage, second stage, and third and fourth stage. In the first stage of cancer, there are no separate stage. Number 1, cancer is localized. You know that cancer that colonized in small area and has not spread to lymph node, no spreading to lymph. And in the second stage, ground best and non-spread. And in stage number 3, cancer have ground larger and have possibility spread to lymph node. The final stage, the stage number 4, cancer have spread to other organ and other area of our body, of the body.
Right.
Thank you very much.
Thank you
I
for
have
you.
only this. Thanks very much. My best wish to you. Hope you healthy and always healthy. Thank you very much to all my respected speakers. Thank you very much, Dr. Dari.
Thank you so much, Prof. Rashid, for this good and really right comments. Thank you. Sorry, if there is another question, if there is any other comments.
Thank you very much. No.
Thank you. Thank you. Really, I am delighted to say some warm word of welcome to my respected colleagues, Assistant Prof. Dr. Nahla Abdul Hamid Abdul Jabbar, the Dean of College of Science, for his participation in our...
Thank you for all, Dr. Dari.
Yes, thank you, Dr. Nahla. If you have any comments, sorry.
Thank you very much. Very nice workshop.
I will respect the Dean of the College of Science, Dr. Nahla Abdul Hamid.
Thank you
very much.
Okay, that's fine.
Thank you for all of you.
Thank you.
Yes, sorry, Prof. Imad.
I just want to have a few comments, really.
Yes.
Comments on Prof. Rashid. He done very well, really. He was talking about the immunology. If there is a chance once a time to go for a very important topics in cancer research and in cancer immunology, which we call it how cancer cells escape immune system. This is whenever we have cancer cells can hide, can mask itself, and also can escape the surveillance of the immune system. That's why sometimes they are talking nowadays on the new methods of how they are going to kill the cells or tumor cells. Maybe they are also going to have this same sort of behavior that they can escape the treatment sometime. I think the treatments nowadays, the application of the treatments in vitro is okay. Yes, they are proven to be good. But how about in vivo? In vivo studies, I think they need to be more elusive on so many types of functions to the cell. This is one. The second thing is that there is a fact, really. All tumors, all cancers, they are classified as tumors, but not all tumors can be classified as cancers. Yes, this is again is very important. But you know, sometimes a misnomers to the tumor side, they call it tumor whenever there is tumorogenesis can go in the tumor cells or the cells in the body as in general when they are going to be changed to cancerous or tumorous. That's why they are there is a difference, really, definitely, because even inflammation can cause tumor. I mean, swelling. Tumors means swelling, really. So that's the way. Many misnomers nowadays in cancer nomenclature. We need also to understand that, because clinicians, they are not sometimes describing the tumors like the pathologists. And it happens that there are some differences in the reports that's been issued by both parties, really. Okay, thank you very much. I just want to give these.
Thank you so much, Prof. Imad. Thank you so much, my respected colleague, Dr. Lutfi. Thank you so much, Dr. Muhammad Naji. Thank you for all of you for this nice today workshop, international workshop. Alhamdulillah. Now we reach the finishing. I think there is no question. I think There is no any comments. Thank you for all of you.
Thank you.
There is
Thank you.
anything.
Thank you, Doctor. Thank you.
Wishes to
Thank you,
all,
Dr.
really, wishes to all, and I would like to thank the university and the dean. Is okay. That is very nice to be with us, really. And Prof. Dari, thank you very much. We are really long-acting, really, long-acting people in the science of medicine and veterinary medicine, and also the medical field, really. Thank you very much, Prof. Dr. Muhammad.
Thank you,
You are
Professor.
also a very good presenter, and also Prof. Lutfi. Inshallah, we will meet you sometime personally. Thank you very much. Thank you.
شكرا جزيلا للجميع. Thank you for all of you.
Thank
Thank
you.
you.
Thank you
I
for
think
you.
we need to leave now.
We hope to meet you again, inshallah, in the future.
We need to leave.
شكرا دكتور صالح.
Thank you, dear. Bye.
شكرا بارك الله فيكم. شكرا جزيلا.
Thank you.
شكرا دكتور
بارك الله فيك.
شكرا.
يا أمان الله. يا أمان الله.
وتاني دورة
ما-
ما الله عيني.
تصبحون.
مع السلامة.
يجي يعني ندانا يعني
أمان الله.
نعطوها بو ايش قلتي نشبي ليش قلتي او كل بو يدي بو تالي بوتال بقى ولو تزينابي في العقد دريجة زبنابي ايش ما نقول ما ميله ورا اتبرو زي كده ولدكم ورا اتبرو بوتينا a monte a far mille montosina qua vicino dopo